Okay, this is for the 26, the number you gave me, Susan, for the proficiency. I'm going to start by washing my hands. Then hi, I'm Connor. I'm going to be your student nurse today. I'm going to be doing a focused neuro exam on you. Can I please see your name and ID band? Allergy band?
Okay.
Tell me your name and date of birth.
Stephanie Whelan, May 1766.
Okay. I'm going to drape you real quick. Do you currently have any questions about the neuro exam?
No.
Okay, so everything's going to be confidential. There's going to be it's not going to leave this facility. So we're going to start off with cranial nerve 1, which is for smell. So what I want you to do is occlude one nostril. Okay, breathe in and out. Okay, and do the same with the other one. Okay, then both nostrils are patent because we were assessing for patency. Then the next thing is I'm going to have you close your eyes, and then you're going to occlude one nostril, and I'm going to give you a scent, and you're going to smell what it is, okay?
Mm-hmm.
Okay. What's that smell like?
Vanilla.
Yep. Okay, close your eyes and do the same thing for the other side.
Peanut butter.
Yep. Okay, so she can correctly identify both smells of peanut butter and vanilla. So cranial nerve 1's intact. For cranial nerve 2, it's for eyesight. I would normally do the Snellen and the Jaeger test. So she would stand 20 feet away, cover one eye, read down as far as the chart as she can read, and that would be her score. Unless she misses more than 2, it would go back up to the line above. And that would be the same for the Jaeger test. The card would be 14 inches away. Same thing, read down, read down. So what I'm going to do now is the peripheral fields test. So whenever you see the wiggle of my fingers in your peripheral fields, say now.
Okay.
So we're going to do superior.
No.
Temporal.
No.
Inferior.
No. No.
Oh, okay. I should have said stare forward, my bad.
It's okay.
Okay. So she can see all 8 peripheral fields. I would normally do an ophthalmoscopic exam. So I would get up close to her and I'd look at her, like the cream and white background of her eye. I'd look for the venules and arterioles. So I can't do that, but I just thought I'd mention that here. So her cranial nerve 2 is intact, and we are going to move on to 3, 4, and 6. So right now, just looking at her eyelids, there's no redness, swelling, edema of any kind. There is no ptosis, esotropia, exotropia, entropy, and ectropion. There's no arcus senilis or discharge. So we're going to move on to Perla, and I'm going to grab my little tape. Okay. So right now her pupils are about 5 millimeter around. Or her right one was. Yeah, so 5 millimeters bilaterally for her pupils. Then I'm just going to shine the light. Okay. They have, they're reactive to light. They do have consensual response. And then I'm going to have you focus on the tip of this, and just focus as I bring it towards your face, okay?
Mm-hmm.
Okay. So they're 5 millimeters around for her pupils. They're round, they react to light, they accommodate, and they have consensual response. So the next one is called the positions test. I'm going to have you focus on this. I'm just going to make a letter, okay?
Mm-hmm.
So focus on it. Okay. So she was able to follow the tip of my pen, so she can see through all 6 fields of gaze. And then the next one is called the cover-uncover test. So I'm going to take this piece of paper, I'm going to cover one side. I'm going to have you focus just straight on my forehead, and I'm just looking for, make sure that your eyes remain fixed. Yep. Yep. So her eyes remain in fixed positions bilaterally. So cranial nerves 3, 4, and 6 are intact. And then we're going to move on to cranial nerve 5. So I'm going to palpate the your temporal and masseter muscles. So I'm going to have you clench your teeth. Okay, clench your teeth. Okay. So there's bilateral constriction of her temporal and her masseter muscles. And then we're going to do a sensory portion, okay? So I don't have a cotton swab with me, so I'm just going to use the tip of my finger, and that's going to be for my light touch. I'm going to have you say now whenever you feel it, okay?
Am I supposed to close my eyes or keep them open?
Close them.
Okay.
Okay.
No. 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 No.
Okay. So she is able to identify light touch. I'm going to grab there it is. For my sharp and dull, I'm going to break it. So same thing, you're just going to differentiate between sharp and dull. So say sharp if it's sharp, dull if it's dull.
Dull.
Yep.
Sharp.
No, it's dull.
Sharp. 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 Dull.
Yep. Okay, so she was able to, for the most part, differentiate between sharp and dull, except for right up here. She said it was sharp, but it was actually dull. So cranial nerve 5 is intact, and then we're going to move on to 7. So what I'm going to have you do is I'm going to have you just do 7 little facial expressions for me.
Okay.
So I'm going to have you smile, frown, I know, wrinkle your forehead. Yeah, okay, that counts. Then raise your eyebrows. Okay, puff out your cheeks. Show your teeth. Okay, I already said that one. Okay. So she's able to perform all 7 functions. Then I'm going to have you close your eyes and just don't let me open them, okay?
Okay.
Okay. So she is able to keep her eyes closed against resistance as well. And for this portion, I would say I'd test for taste on the anterior 2/3 of her tongue. Cranial nerve 7 is intact. And then now we're going to move on to 9, 10, and 12. So what I'm going to have you do is just take a swallow for me. Okay. So she can swallow without any difficulties. Drawing a blank here. Oh yeah. Okay. I'm going to use this as part of my, actually no, spoon. I'm going to use this for my tongue blade. Then I'm going to have you open up your mouth, stick out your tongue. Say ah. Okay, so her soft palate and her uvula are midline. They both rise bilaterally upon phonation. And then the next one is for your tongue movement. So I'm going to have you, open up again. Okay, I'm going to have you move it side to side. Okay, I'm going to have you stick it out. retract it. Okay, then I'm gonna have you push it on the outside of your cheek. Okay. Okay. So she can protract, retract her tongue, move it side to side, and she can push her tongue back against resistance. So cranial nerves 9, 10, and 12 are intact. And then now we're going to move on to 11. So I'm going to have you shrug her shoulders. Okay. And then do it again. Okay. So she has a strong contraction of the trapezius muscles with resistance. So then I'm going to have you turn your head left to right. I'm going to pull your hair back for a second because I need to look at this. Okay. So look left to right. Okay. Okay. So there is a strong contraction of the sternocleidomastoid joint, or muscle, sorry. So then cranial nerve 11 is intact. So now we are just going to move on to some walking. So what I'm going to have you do is I'm going to have you just walk normally. There you go. So just go. Let me make sure it's in the view. Yep. Okay. Make sure it's in the view. Yep. Okay, good. So just walk to like half the table and walk back. Okay. So your gait is steady. You had a little bit of opposition swinging in your arms. Your base of support's good. You can bear weight evenly. So what I'm gonna have you do next is called tandem walking. So just kind of walk like it's a sobriety field test. So then, okay. Yep. And then next I'm gonna have you do is walk on your heels. Okay. And then on the way back, oh that works, whatever, that's fine. Walk on your toes, like this. Okay. So she can tandem walk and walk on her heels and walk on her toes with no loss of balance. So then the next thing I'm going to do is, can you come right here, please? It's called the Romberg test. So I'm going to just time you for 15 seconds. Stand here with your eyes open and just see how your balance is. Okay. Then I'm going to have you close your eyes, okay? Okay, so negative Romberg test, she had minimal to no swaying. And then the next thing I'm going to have you do is I'm just going to have you kind of bend your knee and stand on one leg. Just do one little hop. Okay, and then do it for the opposite leg. Bend your knee, do a little hop. There you go. Okay, so she is able to hop on both legs with no loss of balance. What's next? Okay, I'm going to have you sit back down. Okay, so then next is, oh, I skipped 8. I need to do that one. So vestibulocochlear. So this just assesses your hearing. So what I'm going to do first is the whisper test.
Okay.
So I'm going to just whisper a 2-syllable word, repeat it back to me, okay?
Mm-hmm.
Okay.
99.
Yep. Okay.
Baseball.
Yep. Okay. So she can correctly repeat the 2-syllable word. Then we're going to do the Weber test. So, just going to place it on your head. Okay, where do you feel the vibrations at? Do you feel it equally?
Yeah.
Okay. Okay, so she can hear the vibrations equally with no lateralization to one ear. And then, I know this part's gonna be bad. So then we're gonna do the Rhine test. So it's gonna compare air conduction to bone conduction. So I'm going to place this on right behind your ear on your mastoid process, and then tell me when you feel it, or you hear it stop.
Stop.
Okay.
Stop.
Okay. This thing's juiced up.
Yeah. Stop. Oh, wait. Stop.
Sorry. Okay.
Stop.
Okay. So her air conduction is 2 times longer than her bone conduction. So cranial nerve 8's intact. So now what we're going to do next is, so I did balance, and then I did the Romberg test, and we did the knee hop. So next what we're going to do is the I'm drawing a blank here, my word. I have you do this. So
Okay.
So I'm gonna have you tap your thumbs together. Increase your speed. Okay. So she can tap all her fingers with increase in speed. Then what I'm gonna have you do is this. So you're gonna tap your nose. Do it 3 times. Keep your eyes open. Then close your eyes and do it 3 times. Okay. So she can tap her nose 3 times correctly. So then I'm gonna have you do a thigh pat. Increase your speed. Okay. So she can increase her speed with her thigh pats. What else? Okay, then we'll move on to vibration of sensory. So I'm gonna have you roll up your sleeves. After you do this. So we're gonna do soft and light touch again, and dull and sharp to her anterior posterior thorax, her upper and lower extremities. So I'm gonna start with light touch.
Yeah.
Now, I gotta say now when you feel it.
No.
Okay. I'm not really gonna pull her shirt down, but okay.
No.
So
No.
okay. Then we're gonna do the abdomen or the legs.
No.
Okay. So she can feel light touch, and then I need to do it on the back too.
No.
Okay. So then next we are going to do soft, or man, I can't talk. Sharp versus dull. Okay. So we're gonna start here.
Dull.
Yep.
Dull. Sharp. Dull.
Yep.
Dull. Sharp. Dull.
Yep.
Dull. Do it again. Sharp.
Yep. Okay, and we're gonna do it on your chest.
Dull.
Yep.
Sharp.
Yep.
I think dull.
Yep.
For sharp. Sharp. Dull. Sharp.
Okay, and we're gonna do it on the backside.
Sharp. Dull.
Yep. So she can identify sharp and dull as well. So then, yeah, roll on your sleeve.
Go get it. That's all right.
Okay. Then we're going to move on to vibration of. Nope.
No.
Can't help me.
Oh, I put it back on without you telling me. So.
Yeah. We're gonna do on the tip of your finger, and in your radius. So tell me when you feel it and when it feels it stop.
Yes. Stop.
Okay.
Yes. Stop.
Okay. On their arm.
Yes. Stop. Yes.
Oh, wrong finger.
Yes. Stop.
Okay. Then I'm gonna do it on your medial malleolus. Down here. And, okay.
Yes. Stop.
Okay.
Yes. Stop.
Okay.
Yes. Stop.
Okay.
Yes. Stop.
Okay. So she can feel vibrations. I've washed my hands. That. She can feel vibrations. She can feel. Okay, she can do all that. Then we're gonna do the. I'm gonna have you close your eyes, and we're gonna put two different objects in your hands. I'm gonna have you identify them. Okay. Okay. So close your eyes. Okay. What does this feel like?
Battery.
Yep. Okay. Then keep them closed. What's this feel like?
Coin.
Yep. Okay. Then next we are going to. I'm gonna get behind you, and I'm gonna draw a shape on your. Shape or number or whatever on your hands, and identify it for me. So I'm gonna have you close your eyes. I'm gonna get behind you.
G. Oh, do it again, please. O.
Yeah.
4.
Yep. So she can identify which figure I drew on her hands, both of them. Then next we're gonna do is called graphesthesia. Okay. No, that's what I just did. So I'm gonna do. I'm gonna have you hold out your hands. Or one hand. I'm gonna have you close your eyes and tell me which way you feel your finger move. Okay.
Down. Up. Down.
Do this hand.
Down. Up. Down.
Okay. And this one.
Up. Down. Up.
Okay.
Down. Up. Down.
Wash my hands. So she can correctly identify the direction of her fingers and toes, up and down. So next what we're going to do is the reflexes. Wait, no. I'm going to touch you in different spots. I'm going to have you point to where it's at.
Okay.
So close your eyes, then touch here. Okay. Okay. We're going to go down the lower, so keep your eyes closed.
Okay.
Okay, then we are going to move on to reflexes. So I'm going to use the side of my stethoscope right here. I'm going to assess her triceps, biceps, brachioradialis, Achilles, and her patellar, her deep tendon reflexes. So I'm going to do her triceps. So what I'm going to do is kind of have you go loosey-goosey on your arm. Tap it. Okay. Now we're going to do the same on the other one. Okay. That's it. Okay. So I'm gonna say that's a +2. Then I'm gonna do your biceps. I'm gonna have you just kind of relax your arm. Okay, so there's flexion with the elbow and wrist. Okay, so that's gonna be a +2. And then I'm gonna do the brachioradialis. Okay, so on this one. Okay. Okay. Then we're gonna do her patellar. Thank you.
I hate this one.
I know, me too. Does it hurt?
I
Okay.
just don't like the feeling.
Okay, we're gonna do that one. Was that legit?
That was legit.
Okay. Okay, we're gonna do your Achilles.
That's hyper reflexive. That was real.
Okay. So I'm gonna give these a +2. This one a +2. This one probably a +4. So next we're gonna do your superficial reflexes. So it's gonna be your abdomen, your by your feet, and what's the last one? I ain't doing cremasteric. So that's done on males, and when you do on one side of the thigh, the scrotum deviates towards that side of the stimulus being applied. So I'm just gonna start with your feet. So then I'm gonna have you go back on your back, and we're gonna do your abdomen. Okay. So I'm gonna start here. I'm gonna work on the lateral side. I'm gonna work towards my way out. Okay. So I kind of saw some flexion of the toes there. Okay. A little bit of flexion of the toes there too. And then I'm gonna have you go on your abdomen.
Lay on my stomach or lay on my back?
Lay on your back.
Oh, okay.
No, sorry. Yeah.
Anyway. The table doesn't fall.
Yeah, me too. Catch that on YouTube. Okay, I'm gonna pull this up. Just keep it covered. I'm just gonna go up to right about here. Okay, so I'm just going to. Okay, a little bit. So there is slight contraction of the muscle on which side the stimulus applied, and the umbilicus moves to that side as well. There's something else I was forgetting to do on your back. Oh yeah, for the coordination, I'm gonna have you take your heel.
Mm-hmm.
I'm gonna have you run it up and down your shin. So do your right leg. Okay, and do your opposite. Okay, so she can also move her shin up and down as well. How are we doing on time? Oh, 20. I got 2 minutes. So her eyes are open, so +4 for the Glasgow-Coma scale. She is oriented, so +5. She obeys my verbal commands, so +6. So for his total score 15. So what we're gonna do is called the Kernig's. No, not Kernig's. Mary's test. I keep on getting these mixed up. So I'm gonna put my hand here. I'm gonna have you kind of just lift up your head. I'm just gonna lift it up. Do you have any pain in your hips or?
Mm-mm.
Okay. So negative allotment. No, it's not allotment. So I'll stick with it, whatever. Okay, Kernig's. So I'm gonna flex your leg here. I'm just gonna extend it. Do you have any pain?
Mm-mm.
Okay. Okay. And then, do you have any pain?
Mm-mm.
Okay. Negative Kernig's sign. Done.